Erectile dysfunction treatment options and prescribing considerations. Erectile dysfunction, also known as ED, is characterized by the inability to attain and/or sustain an erection and affects approximately one-third of adult males. Lifestyle choices associated with ED include sedentary behaviors, obesity, smoking, and the abuse of illicit substances such as cocaine or alcohol. Additionally, various physical conditions such as atherosclerosis, diabetes, kidney disease, stroke, and hypertension can contribute to ED. Psychological factors like depression, fatigue, guilt, and fear of failure also play a significant role in the development of ED. There are certain commonly used medications that include thiazide diuretics, beta blockers, SSRIs, and antidepressants that may exacerbate erectile dysfunction symptoms. It is essential for healthcare providers to consider these factors comprehensively when assessing and treating individuals with erectile dysfunction. As outlined by our textbook and the Erectile Dysfunction and BPH PowerPoint via Blackboard, first-line treatment for erectile dysfunction encompasses a multifaceted approach aimed at addressing underlying lifestyle factors and potential medication-related contributors. This includes advocating for lifestyle modifications such as increased exercise, weight loss, smoking cessation, and stress reduction, which can positively impact ED symptoms. Additionally, modifying medication regimens to eliminate drugs known to contribute to erectile dysfunction is recommended. We can see the table next here for those commonly used drugs. Also, drug therapy with phosphodiesterase 5 inhibitors, also known as PDE5 inhibitors, is the primary treatment options. Medications such as sildenafil, tadalafil, verapamil, and avanafil are commonly prescribed to enhance erectile function and improve sexual performance in individuals with erectile dysfunction. Just looking at this chart, you can see the cardiac glycosides such as digoxin have a 30% chance of increased incidences of erectile dysfunction, such as some CNS drugs, SSRIs, up to 70%, and then social lubricants / intoxicants such as alcohol, 50 to 75. So we want to consider if patients are taking those and make some adjustments if needed. So when prescribing phosphodiesterase 5 inhibitors such as sildenafil, which is the prototype we've been learning about, we want to discuss the mechanism of action and any adverse effects. So the mechanism of action involves the inhibition of cGMP breakdown, which extends the effectiveness of vasodilator mediators like nitric oxide, thereby aiding in the maintenance of an erection. However, while these medications are effective in treating erectile dysfunction, they may also lead to various adverse effects. They are commonly include headaches, dizziness, syncope, dyspnea, flushing, and hypotension. Additionally, less frequent but more serious adverse effects may include prolonged erections lasting more than 4 hours and some rare occurrences of sudden hearing loss and changes in color perception. When considering the usage of phosphodiesterase 5 inhibitors such as sildenafil, it's crucial to take into account various contraindications and cautionary measures. Some contraindications include, obviously, if you're allergic to it, don't take it, as well as any concurrent use of nitrates such as nitroglycerin, which can lead to life-threatening hypotension. Additionally, conditions predisposing individuals to prolonged erections or the presence of penile implants need to be considered. Obviously, we won't use it in women. It's not recommended. Now, caution should be exercised in patients with recent MIs, stroke, or life-threatening dysrhythmias, especially within the last 6 months, as well as those that experience hypotension and severe hypertension, heart failure, unstable angina, or bleeding disorders. These cautionary measures are essential to ensure safe and appropriate use of the phosphodiesterase 5 inhibitors in clinical practice. Here we will talk about the nursing implications and patient education when using sildenafil. It can be taken with or without food. Important to avoid consuming grapefruit juice. Recommended to take sildenafil approximately 30 to 60 minutes before engaging in sexual activity. Patients should be aware of the potential risk associated with sexual activity, particularly if they have pre-existing cardiovascular disease. Crucial to advise patients to seek immediate medical attention if an erection persists for more than 4 hours, as this can lead to permanent damage. Additionally, if patients experience sudden vision loss in one or both eyes or encounter any onset of hearing loss while taking sildenafil, they should discontinue the medication and promptly seek medical help. Patients should be cautioned against using nitrates concurrently with sildenafil to avoid the risk of life-threatening hypotension. Providing thorough guidance on these precautions ensures a safe and effective use of phosphodiesterase 5 inhibitors when managing erectile dysfunction. This was taken from our textbook on page 460. This is just summary of key prescribing considerations with the phosphodiesterase 5 inhibitors. Some of it will be kind of a repeat of the overview. Obviously, we want to monitor and assess some vital factors before and during treatment, such as heart rate, blood pressure, conducting a thorough eye exam, evaluation of hearing. We want to assess for any cardiovascular disorders, including stroke, hypotension, hypertension, heart failure. PDE5 inhibitors are contraindicated in men taking nitrates, such as nitroglycerin. We already stated that. Also, any pre-existing cardiovascular disease, there is cardiac risk associated with sexual activity and should be carefully considered before prescribing a PDE5 inhibitor or any erectile dysfunction medication. Now, the body's response to the medication may vary depending on the patient's diet and the timing of when it's taken. So it is recommended to do it is recommended to avoid high-fat meals as they can delay the absorption of avanafil, sildenafil, and varanafil, but not tadalafil, thus delaying the onset of action. Now, timing, avanafil should be taken approximately 15 to 30 minutes before sexual activity, while all other phosphodiesterase 5 inhibitors should be taken about an hour, so that 30 to 60 minutes, while tadalafil is FDA approved for daily dosing. Now, also stressing the importance of regular exams for vision and hearing changes is vital, and patients should be informed that prolonged erections lasting more than 4 hours is a medical emergency, and it is requiring immediate evaluation at the local emergency department. And now we're on to the second line treatment. So when the phosphodiesterase 5 inhibitors fail to effectively treat erectile dysfunction, a referral to a urologist for further evaluation and management is recommended, as stated in our PowerPoint drugs for BPH and ED. Alternative therapies may be considered in consultation with urology that include penile intracavernosal injection therapy, medical intraurethral systems for erections, vacuum erection device, and penile prosthesis. These options provide additional avenues for addressing erectile dysfunction when the phosphodiesterase 5 inhibitors prove inadequate, and this ensures comprehensive care for individuals that experience erectile difficulties.